Good morning, everyone. I would like to thank the ASH Committee for selecting the GMMG HD7 trial of the German-speaking myeloma multicenter group as a presentation at the ASH press conference today. I will present the results of the addition of Isatuximab to Lenalidomide, Bortezomib, Dexamethasone as induction therapy for transplant-eligible patients with newly diagnosed multiple myeloma. Please see the disclosures of the authors. The combination of lenalidomide, bortezomib and dexamethasone, referred as RVd, is recommended for fit patients with newly diagnosed multiple myeloma. Regimens incorporating anti-CD38 monoclonal antibodies are becoming the new standard of care in multiple myeloma patients. Maximizing the treatment efficacy is important to achieve long-term remission. Isatuximab is a monoclonal antibody targeting the CD38 antigen, a specific epitope widely and uniformly expressed on myeloma cells. Isatuximab is approved in several countries in combination with dexamethasone plus pomalidomide or carfilzomib in patients with relapsed or refractory multiple myeloma. I would like to draw your attention to the flowchart of the HD7 trial. This trial included transplant-eligible patients with newly diagnosed multiple myeloma up to the age of 70 years. The patients were randomized in a 1-to-1 ratio stratified by revised ISS to receive Isatuximab RVd or RVd alone. Induction phase consists of 3 6-week cycles, adding up to 18 weeks of treatment. The first primary endpoint in the HD7 trial compared MRD-negativity of isa-RVd versus RVd at the end of induction treatment. MRD was assessed by next-generation flow cytometry at a sensitivity of 10 to -5. Secondary endpoints were complete response rates after induction treatment and safety. The data cutoff for the present analysis was April 2021. After autologous transplantation, a second randomization will be performed to compare the addition of Isatuximab during maintenance treatment to the current standard of care of lenalidomide maintenance. The baselines of the patients were generally balanced between both treatment arms. There were no significant difference in age, sex, performance status, renal impairment, high-risk cytogenetics, and ISS stage. There was an increased number of patients with revised ISS stage 2 in the isa-RVd arm compared to the RVd arm. Here are the results of the first primary endpoint. The MRD-negativity rate in the isa-RVd arm was 50.1% compared to 35.6% in the RVd arm. The study met its primary endpoint. The difference in MRD negativity rates translates into an odds ratio of 1.83 favoring isa-RVd versus RVd. The p-values for this resultant were highly significant. Isa-RVd is the first regimen to demonstrate significant MRD negativity benefit at the end of induction versus RVd in a phase 3 trial. The benefit of the addition of isa to RVd versus RVd regarding MRD negativity after induction therapy was consistent in all subgroups. The addition of Isatuximab to RVd induction therapy did not adversely impact the overall safety profile. Rates of adverse events as well as serious adverse events did not differ between isa-RVd and RVd. A comparable number of patients discontinued induction therapy in both arms due to adverse events. Expandedly, leukocyte and neutropenia occurred more frequently with the addition of Isatuximab, but this did not translate into increased rates of infections during induction treatment. The rates of infusion-related reactions, grade 3 or 4 with Isatuximab were low. The addition of Isatuximab to RVd did not impact the dose intensity of RVd compared to RVd alone. The GMMG HD7 trial is a first phase 3 study powered to evaluate MRD negativity at the end of induction treatment in transplant-eligible newly diagnosed multiple myeloma patients. MRD-negativity was 50.1% with the isa-RVd, with the intention to treat analyses at the end of 18 weeks induction phase. The first primary endpoint of the HD7 trial was met, demonstrating superiority of reduction therapy with isa-RVd compared to RVd. This is the highest MRD negativity described to date in a randomized phase 3 trial setting. The addition of Isatuximab had no significant effect on the safety profile or dose intensity of the RVd backbone. The study is ongoing. Following a second randomization, we will compare the standard of care lenalidomide maintenance versus lenalidomide plus Isatuximab. Isatuximab is currently being investigated in combination with RVd as well as Cardi in other phase 3 studies for the treatment of patients with newly diagnosed multiple myeloma. I would like to thank the participating patients, their caregivers, and the study centers with the investigators for the contribution to the study. The GMMG HD7 trial was supported by grants from Sanofi. Investigational medical products used during the trial were Isatuximab, provided by Sanofi, and lenalidomide, provided by BMS. Thank you for your attention. I'm happy to answer your questions.